Blood pressure is one of the most crucial indicators of cardiovascular health. Whenever you visit a doctor or measure your blood pressure at home with an electronic device, you'll see two numbers: the upper number, systolic pressure, and the lower number, diastolic pressure. The systolic reading, ideally around 120 mmHg, reflects the pressure in your arteries when the heart contracts forcefully to pump blood throughout the body. This is the peak pressure moment, showing how hard your heart works to supply oxygen and nutrients to tissues. If systolic pressure is consistently elevated, it signals that your heart is straining excessively, arterial walls are under constant stress, and long-term damage to blood vessels and vital organs is inevitable. The diastolic reading, typically around 80 mmHg, represents arterial pressure when the heart is resting between beats. This phase of relaxation allows the heart chambers to refill with blood, preparing for the next contraction. Elevated diastolic pressure indicates stiffened arteries and reduced vascular elasticity, meaning your circulatory system is constantly under higher baseline strain. Both numbers matter. Keeping them within healthy ranges ensures that your heart, blood vessels, kidneys, brain, and eyes remain protected from damage. Understanding these numbers and monitoring them regularly is not merely a medical formality. It is a vital act of self-preservation. Hypertension, or high blood pressure, has long been nicknamed the silent killer. The reason is chilling. Most patients feel no symptoms at all until catastrophic events occur. A person may live for years, unaware that their arteries are gradually weakening, their kidneys slowly failing, and their heart becoming overworked. Then one day, a stroke, a heart attack, or kidney failure strikes, often with little warning. The complications of uncontrolled hypertension are severe. Stroke when blood supply to the brain is disrupted, myocardial infarction when coronary arteries are blocked, congestive heart failure when the heart can't pump adequately, chronic kidney disease leading to dialysis, retinal damage resulting in vision loss, and ultimately, premature death. For millions worldwide, these outcomes arrive silently, which is why proactive management is absolutely essential. Medication plays a central role in managing moderate to severe hypertension, and following your doctor's prescription is non-negotiable. But long-term success in controlling blood pressure doesn't come from pills alone. Lifestyle changes and at-home practices provide the foundation that sustains healthy numbers. These natural, practical measures not only lower blood pressure but also improve overall well-being, enhance mood, and prevent future illness. So what strategies can be implemented at home? The first and most important step is weight management. Excess body fat, especially abdominal obesity, is strongly linked to high blood pressure. Carrying extra weight increases the workload on your heart, forces it to pump against greater resistance, and compresses blood vessels. Research shows that losing just 2 to 4 pounds, 1-2 kilograms, can lower blood pressure by 1 mmHg or more. A reduction of 10 pounds, about 4.5 kilos, can drop readings by 5 to 10 mmHg, which is enough to drastically reduce cardiovascular risk. Waist circumference is a simple but powerful measure. Men with a waist larger than 40 inches, 102 centimeters, and women above 35 inches, 89 centimeters, face dramatically higher risks. The good news is that targeted lifestyle changes, balanced diet, portion control, and daily exercise can steadily reduce waist size and lower blood pressure. It's not about chasing a number on the scale for vanity. It's about relieving the constant strain on your cardiovascular system. Next comes physical activity. Regular exercise is one of the most potent non-drug tools for lowering blood pressure. Just 30 minutes of moderate activity 5 times per week can reduce systolic blood pressure by 5 to 8 mmHg. That effect rivals some medications. Brisk walking, cycling, swimming, or yoga all qualify. Exercise improves vascular elasticity, enhances circulation, strengthens the heart muscle, and reduces resting heart rate. Beyond the numbers, it alleviates anxiety, boosts mood, and promotes restful sleep, all of which further support blood pressure control. For older adults, low-impact activities such as Tai Chi or gentle stretching can be equally beneficial, especially for those with joint pain. Diet is equally decisive. The most widely recommended approach is the DASH diet, dietary approaches to stop hypertension. This eating pattern emphasizes vegetables, fruits, whole grains, legumes, nuts, low-fat dairy, fish, and lean meats. These foods are naturally high in potassium, calcium, magnesium, and fiber, all nutrients proven to regulate blood pressure. Potassium deserves special mention. It counteracts sodium, helping the kidneys excrete salt and water, thereby reducing blood volume and pressure. A potassium-rich diet can lower systolic pressure by 4 to 5 mmHg. Bananas, oranges, spinach, tomatoes, sweet potatoes, and beans are excellent sources. On the other hand, sodium restriction is vital. Most people consume far more salt than recommended, often double, mainly from processed foods like canned soups, fast food, sausages, and snack items. Excess sodium traps water in the bloodstream, increases blood volume, and drives up pressure. Cutting daily sodium intake to less than 2,300 milligrams, about 1 teaspoon of table salt, can reduce readings by 2 to 8 mmHg. The World Health Organization recommends aiming even lower, under 1,500 milligrams for optimal benefit. Practical steps include reading nutrition labels carefully, cooking more meals at home, replacing salt with herbs and spices, and avoiding packaged foods when possible. Quitting smoking is non-negotiable. Nicotine causes blood vessels to constrict immediately, raising blood pressure by 5 to 10 mmHg within minutes of smoking. Over time, smoking accelerates atherosclerosis, stiffens arteries, and multiplies cardiovascular risk. The moment you quit, your body begins to heal. Within 24 hours, heart rate and blood pressure begin normalizing. Within months, circulation improves significantly. For hypertensive patients, quitting smoking is as critical as taking medication. Sleep is another underestimated factor. Chronic sleep deprivation, defined as fewer than 6 hours per night for several weeks, raises blood pressure significantly. Poor sleep increases stress hormones like cortisol and adrenaline, which keep the heart in overdrive and blood vessels constricted. Restoring 7-8 hours of quality sleep nightly in a quiet, dark, and cool environment allows the body to repair itself, balance hormones, and regulate blood pressure. Short daytime naps of 20-30 minutes may also benefit older adults. Stress management completes the lifestyle framework. Chronic stress elevates blood pressure directly and indirectly through poor sleep, emotional eating, smoking, or alcohol use. Techniques like meditation, mindfulness, yoga, and deep breathing are powerful, accessible tools. The 4 to 7-8 breathing method, inhale for 4 seconds, hold for 7, exhale for 8, is especially effective in calming the nervous system, reducing anxiety, and lowering blood pressure. Music, nature walks, journaling, and hobbies all contribute to lowering stress hormones and protecting cardiovascular health. Finally, there is a simple but remarkable natural remedy: cardamom. This fragrant spice, widely used in cooking, has diuretic properties that help the kidneys eliminate sodium and water. Taking half a teaspoon daily, divided into morning and afternoon doses, can lower blood pressure naturally by reducing blood volume. Cardamom also contains antioxidants that relax blood vessels, calm the nervous system, and improve mood. It can be easily added to tea, coffee, or meals. Though not a substitute for medical treatment, it offers a safe, supportive boost in blood pressure management. In conclusion, managing hypertension is not about a single miracle cure. It is about weaving together multiple strands of lifestyle habits: keeping weight under control, eating nutrient-rich foods, reducing sodium, staying active, quitting smoking, prioritizing sleep, managing stress, and exploring natural supports like cardamom. Each factor might only lower your blood pressure by a few points, but combined, they produce a powerful, lasting effect. Most importantly, these changes are within your control, can be implemented at home, and will protect your heart, brain, kidneys, and eyes for years to come. By taking action today, you secure a healthier tomorrow.